All right, you guys know I love when I get questions in my DMs because it gives me ideas of what to talk about. And I'm going to talk about my approach for breast surgery in patients who have had a significant amount of weight loss, because I see a ton of those patients. The specific question I got was, can an implant kind of fill out the tissue volume without the need for a lift? It's rare. I think out of the last 5 years of skin removal surgery and breast patients that I've seen who have lost a lot of weight, I think one did not need a lift. One was kind of on the fence, but she wanted that upper pole volume. And the way I measure is I literally measure how much tissue is below the inframammary crease. My cutoff's about 2.5 centimeters. If there's 2.5 centimeters or more of tissue from the inframammary crease down to the bottom where your breast hangs, you generally are gonna need a lift, or the breast tissue will just kind of fall off the implant, which is not a cool look. When I do a lift on a patient who's lost a lot of weight, I leave the implant totally under the muscle. It's not dual plane. I learned this technique from Holly Walls in Baton Rouge. She's a phenomenal surgeon and has some really good long-term data on this technique. But rather than releasing the pec muscle so the implant can settle below it, you leave that pec muscle intact because the breast tissue itself is not a stable support for the implant, and then you lift the breast up onto it. So this is done through an incision around the areola because you want to get the implant in through the muscle first and then lift the breast up onto it. And if you go in through the inframammary fold, your incision can be a little low. So it's very rare that you can do just an implant to fill the tissue back out. The other part of that question was, could you ever do the breast surgery through the body lift incision, which, you know, if you're elevating all the way up to the ribs for a tummy tuck, it's a long stretch. You're not gonna be able to see in the pocket or dissect things precisely. And then part 3 of that question was, can you ever do the implants subglandular, or do they need to be under the muscle? Again, as I mentioned, there's not gonna be a lot of structural support. That inframammary fold gets attenuated, it stretches out, and implants can really bottom out. So for people who have lost a lot of weight, 9.5 times out of 10, it's gonna require a lift. The lift should go under the muscle because there's just generally not enough support with the breast tissue to hold the implant in place, and often the tissue's thin and the implant's really gonna be very visible. And the end incision pattern is that anchor shape, what we call a WISE pattern, because you've got to take out the extra skin that happens with weight loss. So I've got other questions relating to massive weight loss coming up in the next few days, so make sure you watch.